Hello there, welcome to the third part of the video discussion regarding the COPD or of chronic obstructive pulmonary disease. This is the second subtopic which we'll discuss further in the next few minutes. The chronic bronchitis. So, what is chronic bronchitis? So, the definition of chronic bronchitis is the chronic excessive mucus production resulting from an increase in the number and size of mucus glands and goblet cells. So for the overview, in order for us to understand the chronic bronchitis, because there are two types of bronchitis, the acute for the first one and the chronic for the second one, which we'll discuss further. Bronchitis is an inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. People who have bronchitis often cough up thickened mucus, which can be discolored. Bronchitis may be either acute or chronic. So for the causes of chronic bronchitis is obviously smoking. And for the clinical signs and symptoms, for the first one, for either acute bronchitis or chronic bronchitis, signs and symptoms may include signs and symptoms of the chronic bronchitis will include the cough with sputum production. What is the cough with sputum production? It's the production of mucus or sputum, or which we know as phlegm, which we exacerbate after coughing too much or suctioning the patient, which can be colored as clear, white, yellowish, gray, or green in color. Rarely, it may be streaked with blood. And for the second clinical signs and symptoms of chronic bronchitis is dyspnea. Third one is the carbon dioxide retention and hypoxemia in advanced stages. So what is hypoxemia? Hypoxemia is the abnormally low levels of oxygen in the blood. So what is hypoxemia versus hypoxia? Hypoxia is the abnormally low level of blood in the cells or the body. Which is more severe is, I will tell you, the hypoxemia is more severe because it is more in the internal and the blood of the person. And for the fourth one, it is the cor pulmonale in advanced stages. So what is cor pulmonale? It is the abnormal enlargement of the right side of the heart as a result of disease of the lungs of the pulmonary blood vessels. And for the last one, for the clinical signs and symptoms, is the breath sounds, the crackles, wheezes. Then, okay, we'll wait for the third and the next part of the video. Thank you. When to see a doctor for having chronic bronchitis. See your doctor if your cough lasts more than 3 weeks, prevents you from sleeping or having insomnia, is accompanied by fever higher than 100.4 Fahrenheit, or usually common as 38 degrees Celsius centigrade. Produces discolored mucus, as we have discussed earlier, the types of the colors of mucus or sputum. It produces blood and is associated with wheezing or shortness of breath. So factors that increases your risk of bronchitis include cigarette smoke, obviously, having low resistance or low immune system, exposure to irritants on the job. Your risk of developing bronchitis is greater if you work around certain lung irritants such as grains or textiles, or exposed to chemical fumes. Gastric reflux, and for the prevention of chronic bronchitis, in order to prevent and reduce your risk of bronchitis, avoid, obviously, the cigarette smoke. Get vaccinated by having and getting a yearly flu vaccine that can help protect you from getting the flu. You may also want to consider vaccination that protects against some types of pneumonia. Wash your hands, wear a surgical mask. So if you have COPD, you might consider wearing a face mask at work if you're exposed to dust, fumes, and when you're going to be among crowds, such as while traveling. For the diagnosis, chronic bronchitis includes spirometry. During the first few days of illness, it can be difficult to distinguish the signs and symptoms of bronchitis from those of a common cold. During the physical exam, your doctor will use the stethoscope to listen closely to the lungs or to your lungs as you breathe. In some cases, your doctor may suggest the following tests. Commonly is the chest X-ray. Sputum test is that the mucus that you cough up from your lungs can be tested to see if you have illnesses that could be helped by antibiotics. And pulmonary function test. And during a pulmonary function test, you blow into a device called spirometer, which measures how much air your lungs can hold and how quickly you can get air out of your lungs. This test checks for signs of asthma or emphysema usually. So for the treatment is most cases of acute bronchitis get better without treatment, usually within a couple of weeks. However, that is not the case for chronic bronchitis. So for the first treatment of the chronic bronchitis is smoking cessation program. Smoking cessation program, just like we discussed earlier, is we educate the patient for giving her the right medicine, the right protocol on having the right pulmonary rehabilitation in order to bring back them to health. And second one is adequate hydration. The third one is the bronchial hygiene therapy. And the last one for the treatment is bronchodilators such as salbutamol ipratropium, etc. So if you have chronic bronchitis, you may benefit from pulmonary rehabilitation, a breathing exercise program in which a respiratory therapist teaches you on how to breathe more easily and increase your ability to exercise. So that's the last part of the video, and I hope you understand and learn something from what I have discussed deeply on chronic bronchitis, because the pulmonary emphysema was discussed earlier by my group mates Niza